Your baby's the size of a peach. Welcome to week 13. Let's jump in. Welcome, my name's Joanna. I am pregnant. This is my second baby. I'm assuming that you're pregnant too. This is what we've got going on here. I'm making week by week updates about what is happening with baby's growth, baby's development, your body, and my symptoms, my experience. If you want to follow along the journey, please do hit subscribe and follow along. I'd love to have you. But let's jump into baby's growth and development. This week, baby is measuring about 7.4 centimeters long. That's from head to rump, head to bottom. So they are in still a nice little curve shape, and they're weighing about 25 grams. So they're still really small and really light. They're about the size of a peach or a lemon or a kiwi. It literally depends which app you use, which website you look on, but they're like that big. So, you know, a kiwi. Baby has developed their reproductive organs internally, and this week they're starting to grow their reproductive organs externally. So on an ultrasound it isn't very clear. However, some people do have theories about the nub theory and all this. So if you have had your 12-week scan, some people like to try and use the nub theory to predict which gender their baby is going to be. However, it's not very accurate, and most people wait until about week 20 if they are going to find out. Your baby's kidneys are now developed as well, and they're actually producing urine. By about week 20, most of the amniotic fluid that your baby is swimming around in will be pee. This is what protects them from all of your movements and the outside shenanigans. It's largely pee. So what is your baby doing? Baby is really active, and with each week and every day they get to practice all of their movements, so they're not quite as jerky and as random and as reactive. At this point, some babies are even sucking their thumb in the womb, so they're really practicing their motor skills and their movement. And if you do happen to catch your baby suckling their thumb on your ultrasound, it's because they're basically practicing suckling for when they give birth, so they can start to have milk. But while baby is moving, you will not be feeling them at this point in time. They are just so tiny and so light. 25 grams, you will not feel that moving around inside you. If this is your first baby, you're likely to feel baby for the first time around week 18 to week 20. In my first pregnancy, it happened quite a lot later because I had anterior placenta. I can't remember which way around it is. I just kind of dulled out a lot of movement. But this time around, I've got a normal facing placenta, and I felt movements around week 16. I'm speaking in past tense, by the way, because I had recorded all of this, but my iMac died. I lost the footage. Luckily, I've got notes. I keep receipts, so I know what I'm talking about. How your body is changing. Now that you're in the second trimester, your HCG levels, which were really starting to rise in the first trimester, which is why you felt rubbish, you felt really sick and tired, exhausted. That HCG, human chorionic gonadotropin, is now starting to peak and is actually starting to dip now. This will just keep on dipping for the rest of your pregnancy. So a lot of those symptoms that you had in the first trimester will start to be going if they haven't started to go already. So this means that you can be feeling a little bit happier, a little bit more energetic, and you might start to feel that pregnancy glow and just feel a bit happier in yourself. Your uterus is also growing. It's now pushing up and out, so you're now starting to be getting a little bit of a bump. If you haven't, that's okay. Some women just get it later. It just depends on your physiology, how much room there is for your baby in your torso. And around this time, your boobs are probably going to start growing and getting a little bit more tender because your body is going to be preparing itself for the possibility of breastfeeding. Let's talk about the common symptoms. I'm going to put a list of all the NHS symptoms that you may have been experiencing, but the most common symptoms at this point are appetite increase. This is because your nausea and morning sickness will probably start to subside around this time. So as that starts to decrease, you might find that you have much more interest in food again. And in the second trimester and the third trimester, you will slowly start to need a few more extra calories. I think they say it's like an extra sandwich or something by the end of the third trimester. So if you're feeling a little bit hungrier, that's okay, you go for it. You may also have some more noticeable veins. This is a bit random. You might be getting more veins up your legs, in your boobs and in your stomach. This is basically because you have increased blood flow. You have more blood going through your body, and so it's just coming out like you see it. And another most common symptom around this point are skin changes. You'll be having hormonal shifts which are going to be darkening the nipples. This is basically to encourage and allow baby to find your nipples when you give birth so that they could breastfeed. Whether you choose to or not is a whole different matter, but your body will be preparing itself to do that. So they can often get larger and darker so that your baby, basically they can only really see 10 centimeters in front, which is basically the distance from when you're breastfeeding to your face. Another skin change that you might notice is a linea nigra. I think that's how you say it. It's basically a line from your belly button right down your abdomen. Now I want to talk about my experience and my symptoms. At week 13, I had popped. I looked pregnant. I was still getting quite a lot of bloating, and I Even still now, I'm actually 20 weeks pregnant, and I find that in the morning I will have like a little bit of a bump, and then I'll eat food, and by the end of the day I look so pregnant. I had a lot of headaches, particularly in the morning. I am a breastfeeding mum as well as pregnant, so I need quite a lot of water. I don't know if it's dehydration, but headaches are very normal just because of the amount of hormones running through your system. And as I said, I was very thirsty. I need 4 litres of water a day. And speaking of thirst and dehydration, my hands started to get a little bit crusty, a little bit dry. And as time goes on, I feel like I'm just getting crustier, these hands. Around week 13, I started to get bad back pain. This is basically because as your stomach is starting to grow outwards, it's going to slowly be shifting the centre of gravity to the side, caving your back in a little bit, basically, as it puts pressure on your spine, which is why you're going to be getting a bit of backache. Some women will also start to be getting some round ligament pain. This is basically in the sides of your uterus, sides of your abdomen, where your uterus is growing and expanding. I had some nausea still. It was nothing like the first trimester. That was constant nausea. I feel sick in the morning. I need to eat something, and then I feel better. I don't know if it's blood sugars or what, but just need to keep eating. Fatigue. I still had it at week 13, and probably because I am breastfeeding a 15-month-old, I'm tired. Right, this is tiring work, so maybe that's just a me thing. And week 13, I was really having some mood swings. I was emotional, I was needy, tears, I don't know again if it's just breastfeeding, being a mum already. It's all just quite a lot. So that was me for week 13. And now before we round off, let me just share one cool fact about what your baby is up to. This week, your baby's vocal cords are forming. So those cries and those voices that one day you'll be hearing, they're starting to form this week. It's literally so exciting. And their intestines are moving into their permanent position in their abdomen. So they are fully fledged little human. They just need to grow and get big. This is a nice little picture of what your baby's looking like. They're still absolutely tiny. It says that their ankle joints have now matured and their toes have separated. Their eyes are in their final position in their face, but they're looking really, really skinny. They don't have any fat on them yet. That's something that just comes with a bit of time. And if you were to get a 3D or a 4D scan, this is what you would see on your scan. Something like this. The baby here is snuggled right into their placenta, and they're looking very skinny. You can see their ribcage here. They just need to get a little bit fatter. How have you been finding week 13 and your pregnancy journey so far? Please do let me know in the comments. Hit subscribe, like the video, and I'd love to have you follow along the pregnancy journey with me. That's all for now, so I'll see you for week 14. Bye!